through your oral wellness techniques?
I love that question. So, one of the first things that happens when you go to see a psychiatrist or a psychologist or any type of therapist with issues about anxiety is they start to teach you breathing exercises. There is a large research link between breathing and anxiety. There's an even deeper and greater link between our tongue and how we're able to connect to our vagus nerve by having our tongue in a proper rest position, which I'll get back to in a second. But when our tongue is connecting and really stimulating our vagus nerve, we're able to communicate with our autonomic nervous system. That's that fight or flight, rest or digest system, and being able to regulate between the two is a true power for those who have anxiety, because often they're running on that high sympathetic tone, which is that fight or flight, and it really does disrupt their lives. So, breathing we know is very well linked. The tongue we know is very well linked through our dynamic breath work, through our ability to really help people establish proper oral rest posture. So, that's that tongue. Our tongue at rest should be lightly suctioned up at the roof of our mouth. So, from just behind the teeth on the palate, all the way back to our soft palate. We want our tongue to be lightly suctioned up against there. And in that wonderful sweet spot with the back of the tongue, really suctioned lightly against the soft palate area is where you're going to get that stimulation for the vagus nerve. And that's where you're going to find the magic. So, a lot of what we do is very indirect. I'm not ever really targeting anxiety as a whole. I'm just teaching better systems and techniques that are going to help them be able to better manage. And a happy accident that does occur for some people is that there is a reduction in anxiety. There's a reduction in ability to more appropriately manage those symptoms.